Welcome to the 283rd edition of this Fogsi podcast, a brainchild of our president, Dr. Sunita Tandulwadkar ma'am. We hear about her every day, but there are two things that I would like to say today. One is that she is very much into rejuvenation. Her new center has opened in Mumbai, which is called Alive. And I have two people here with me, Dr. Sanjay Sharma and Dr. Sunita Tendulwadkar ma'am, who are actually, working on a tangent from the regular line. Regular IVF, regular obstetrics and gynecology. Very different from that, ovarian regeneration, general regeneration, how to be young and healthy, whatever your age. So, ma'am, I'm really honored to have you here. I missed you so much in my last podcast because that spark goes away if you're not there. So I'm really happy to have you here. And over to you, ma'am.
Thank you, Asha. And thank you, Sanjay ji. Thank you for being in our podcast. It's our honor and pleasure to have you on a Foxy platform. Foxy platform is most honored and most important platform where who's who of the field, any field, it may be academic, non-academic, non-medical, but the best of the speaker, the faculty, or those who have achieved a lot in life, they always come and share their experience and everyone gets evolved. So 280 plus is a beautiful thing. It means for last 280 days consistently, we are at 8 p.m. connected with everyone. And that is thanks to our all chairpersons who are taking this responsibility beautifully. Aisha is one, she's your classmate, I'm aware, but she is one of the most dependable chairperson I have. Her passion, her working style, dedication is beyond I can put in words. Anything I give her, the work is done. And that is what you need in a Foxy or any organization. It is a free of cost. You are not earning money out of it. You have to take out your time from your busy practice, from family time, and you need to devote. That needs a tremendous love for the organization or the passion to do more than what we are doing in our day-to-day life. And Asha, I have given her one project of 100 CMEs on a vaccination across the country out of 286 societies, whichever society she wants to select. And I think in 7 months, she finished those 100 societies, Asha. That made me fell in love with you. I had told GSK I will do that, but I will find out who is the chairperson. But because you are with the drug and food, I thought you are the first person who justified to take this project. And I never needed to see any other chairperson to help because you did it beautifully. So thank you, Asha. And Sanjay ji, neurosciences, sometimes if you believe in autologous, either bone marrow or adipose tissue cells, which has a power to regenerate, I would love to have sometimes a separate discussion with you. Maybe we meet in person or again on Zoom platform. But for the last 10 years, I'm doing it. And I feel neurological, especially stroke-induced paralysis, where people are having very compromised life. Apart from giving probably the B12 and physiotherapy and nothing more we can offer, stem cells can do the miracle and we can bring little quality to their life. There are several publications, several cases now, even in India. So I just want all Indian neurologists to come openly, neurophysicians or neurosurgeons, but come out and do something. Narendra Modi ji says, make in India. We should do something and let the Western country follow our example. I don't know whether you meet Udaipur mein, there is a very good center. There is gynecologist, embryologist, Dr. Manisha. Her husband is doing huge work. And we had a couple of meetings and he is interested in taking this research project. Of course, we had to accept it as a research only. Unless it is proven, it means unless it works for every patient with the said protocol, we cannot call it as it is a gold standard treatment. We have to call it a research. But to become a gold standard, I definitely feel at least 20 like-minded, advanced thinking who has enough work also to do should come together, and we should do this something. Though it is not my field, I feel, because the way I do in infertility and the way few of the neuro friends of mine are doing with us, I feel everyone on the national platform should come up. So looking forward to see you sometimes.
Yeah, I think there should be a separate platform for this regenerative disorder
We should.
process. We should have a separate chapter.
And our protocol says I will join from the viewers link and I'll enjoy the discussion between Asha and Sanjay ji.
Yes, thank you.
Thank you.
Thanks for coming.
Thank you,
Thanks for
Asha.
guiding.
Thank you so much, ma'am. Now it is my pleasure to introduce my friend and colleague, Dr. Sanjay Sharma. Dr. Sanjay Sharma is a neurologist. He works in Ramakrishna Care Hospital, Raipur. And though he's my classmate, he's a star. He's written multiple books. He is into forestry. He is into art and is working in archaeology. He has found a new Vigraha of Lord Vishnu, which is supposed to be thousands of years old. We will hear all that today in this podcast. But I want to start asking you that, we've known you since you were a student and you were eccentric, but that eccentricity has made you a global figure now. You have a blend of science, art, and spirituality. May I know how this blend came up?
So this journey is very typical for me. Once I think about my journey, I born into a Brahmin family with the true orthodox Brahmin values embedded into our family. So naturally, my gene adopted this religion. I adopted this Hindu religion, although without much of orthodoxy and the ritual. But the religion I'm still interested into. I'm interested into the genesis of a religion. Then science. Science is something which brought me a name and fame and everything. And at that time, usually the desire of a parent is that one son should be an engineer and another one should be a doctor. So I followed the path of my father. He was veterinarian surgeon. I qualified this MBBS examination and did my MD in medicine from our medical college, which is Pandit Jawaharlal Nehru Memorial Medical College, Raipur. And subsequently, I traveled to a PGI, Chandigarh, did my DM, neurology, and further trained in Queen's Square, London, which is called as a mecca of neurology. So subsequently, I got my training in the Queen's Square, London. This is way back.
This educational path is common. People will, do a graduation, post-graduation, super specialization, go to the West to train. My question is, where did spiritual art come into it? How did that art and this forestry, how did that blend come about?
So once I have decided to settle down in a Raipur, which is part of central India, and this is surrounded by the jungles, and some very famous ancient temples are all around. So I usually dream like something like Indiana Jones. I am going to a very dense forest, working on the ruins of a temple, looking at the sculpture. That was my dream, which was gradually developed because of my spirituality and because of my science. And then I believe each and every doctor is very sincere observer. So our journey starts as inspection, palpation, percussion, auscultation. The first thing, the all physician, I believe, they are very good observer. They look at the patient, they look at the face of a patient, they look at the body of a patient to make a perfect diagnosis. So inspection plays a great role in deciding a diagnosis. It's true for a painting also. If you look at the painting carefully, if you look at the sculpture carefully, you're going to get into that area. And that's going to connect you with the science also at the same time. You'll suppose you are looking at the painting, and the curator of that museum tells you that possibly this Charles painting, he suffers from a hemophilia, and his lips are thickened. Then you believe that it's likely a painting of a hemophilic patient. So that's how my journey started, Asha.
Okay. Okay. So that is how basically your skills, the same skills that help you in medicine, have
Yes,
helped you
sure.
in art and spirituality.
Yeah. This is basically a keen observership. So if you observe things very closely by your brain, by your heart, you're going to get there, what you're looking for.
So now we come to the next question. You are a very good diagnostician, very well known. I have also come to you. So what I want to ask you is, what actually shaped this neurological thinking? Each of us,
So practically at my time, most of the students are interested in the cardiology. Cardiology was a key thing, and echocardiography equipment was already there. Neurology, it was difficult to clear the examination at that time because it's a pure art of a diagnosis, localizing where is the lesion is, which part the brain lesion is, or whether it's in a spinal cord. You think about it, you look at it, and you do not have a confirmatory method with you. So at that era, the CT and MRI was not there. So it was a pure clinical art. But my journey started with my thesis topic, that topic which I did under Dr. Shashank Gupta and S.R. Gupta, sir, in a department of medicine. This is a prognosis of non-traumatic coma. So I was looking at the comatose patient, collecting a data, and judging the prognosis in this group of a patient. Remember, in that era when the CT and MRI was not there, although at times the diagnosis is a bit faulty. Suppose for a diagnosis of subarachnoid hemorrhage without CT or MRI, we used to do a lumbar puncture and see whether CSF is hemorrhagic or not. By the basis of a hemorrhagic CSF, we used to make a diagnosis of subarachnoid hemorrhage. Nowadays, it's not possible. Now you have got a CT or MRI or other modalities to diagnose this. But that was the era. So I did a thesis on a non-traumatic coma, and during DM days, there was no doubt in my mind that I have to do a neurology. I had to pursue my career as a neurologist.
when we are coming into a branch, there's a lot of curiosity and the will to learn and to do some good in the world. Now you've been in this field for decades together. How do you maintain that curiosity, that beginner's spirit? How do you maintain that?
So reading and writing, like you are doing, you read a lot, you indulge into right of journal reading, you think about your subject, and same time you are observing your patient, writing about them, working on a manganese toxicity or working on voltage gated potassium channel. So it comes naturally to be in a subject and to avoid this common problem of what they call as a burnout. So to avoid this problem of burnout, you have to be thick into a subject and you have to draw interest. You take it as your hobby to indulge into your subject. Otherwise, you are going to be not nowhere. You are going to fed up. You are going to be burnout, which is now a big problem in doctors or physicians.
In neurology, like the patient you were telling about, a patient in coma. So, you see a patient in coma, like it happens with oncosurgeons or oncologists when they see a terminal patient, that there's a sense of detachment. There's a sense of detachment even in the doctor. So how do you maintain your empathy?
It's the core of a subject to maintain empathy. and it's situated somewhere deep into your parietal lobe. Empathy, a center for empathy, is situated deep inside your parietal lobe. So until unless you do not have empathy, you are not going to take care of any patient at all. Forget about the comatose patient or other patient who is about to die. You are not going to take care. Without empathy, these things are not possible. So nowadays there are three branches: taking care of a coma, palliative care for terminally ill patient, and end of the life care. You have to explain each and everything. And until unless you are attached to the patients or patient's relative, you're not going to have this. You're not going to explain them. So empathy is something which is a basic demand for every clinician. You should have a deep empathy for a counterpart
So your
to whom you
parietal
are
lobe is
serving.
working really well.
Yes. Yeah.
So now we come to the next part, and that is, we are gynecologists, and a lot of the listeners today are going to be gynecologists.
Mhm.
Many neurological conditions
Mhm.
intersect with pregnancy. A patient with epilepsy getting pregnant, stroke, migraine, and even myasthenia gravis in the elderly.
Mhm.
So, what do you think we as gynecologists should know about neurology?
There's hell of a responsibility with the gynecologist.
Yeah.
So we have to take a one by one. Should I take them one by one? So if
Means
you
what
talk,
I'm saying is that, we should know enough to diagnose and then be able to refer, or there are some things that we should manage. What do you say?
so there are pre-existing conditions which exist before a pregnancy happens, or there are the other disorders which are developed during a pregnancy, where you may take another consultation from a neurologist also.
Okay.
So the first thing is about talk about epilepsy,
Epilepsy.
which is a very common problem.
Yes.
If there is pre-planned pregnancy, there is not much of a problem. If pregnancy is not planned and after 2 or 3 months after the formation of a baby, someone comes with unplanned pregnancy, then there is all sort of a problem. Basically, we have changed the name of anti-epileptic medication. It's no longer anti-epileptic medication because epilepsy is some kind of a stigma. So we have changed it to anti-seizure medication. We call it as anti-seizure medication. You have to choose them carefully. And what is the criteria of choosing those anti-seizure medication is what is the rate of malformation. What is the rate of malformation of a minor malformation? What is the rate of a major malformation? In normal population also, there is a risk of a 1% malformation. Without having any exposure or to toxin or environmental toxin or medication, there is a 1% chances. So usually if they are less than 1.4 or 2%, we think it's a safe. Right now, the levetiracetam is a drug which is fortunately most commonly used. It's relatively safe. The older anti-seizure medication, they had a problem. So they are all four: carbamazepine, phenytoin, valproate, and phenobarbital. Valproate is the most notorious drug that produces malformation and several other side effects. So this is regarding a pregnancy. Second thing, as the body fluid increases, the dilution goes down of a drug. And you need more and more higher doses of a medication during a pregnancy rather than the misconception of discontinuing that medication. Many times the first question which gynecologist ask or obstetrician ask is whether we can stop this medication. No, it's not possible. The seizure risk is very high. You have to continue, or you may have to continue it in a bit higher dose rather than a low dose of a medication. So this is second thing. Then in adolescence also, there is a joint responsibility of everyone, whether it goes into pediatric section or a medicine section, they have to choose a safe drug. Especially in females, they should not choose a salt called a valprool or valperine or those kind of a salt. Sodium valproate should not be chosen as a drug of a choice because it produces a polycystic ovary. So there are chances of infertility. During a pregnancy, it produces a problem. It produces a neural tube defect. It produces fetal malformation like anencephaly. So valproate is absolutely no. There's a list of drugs which are safe And fortunately, drug which we are using nowadays, most of the cases, most of the is safe. But single drug is safe. Single anti-epileptic medication, anti-seizure medication is safe. If there is a combination of a medication, polytherapy is going on, and patient is still throwing a seizure, those patients are at greater risk of a malformation.
Okay.
So, take about migraine. Should I continue with the migraine?
I will ask you the next question that, there are neurological emergencies like CDT or press.
Hmm.
So what are the triggers that a gynecologist should know to be able to recognize it early?
So, preeclampsia, eclampsia, or PRES, which is posterior reversible encephalopathic syndrome. These are hypertensive disorders. These are hypertensive disorder, and it results from hypertension, right? Uncontrolled hypertension leads into a condition called as a PRES. When there is edema in occipital lobe, patient may become blind, or there may be visual disturbances. There are convulsions. There is alteration in sensorium, and at time, if patient deepens into a coma, patient may require intubation and
See,
ventilation.
we see eclampsia all the time. And these are things that we also see in eclampsia. So how do you actually differentiate?
So the red flag sign is having any alteration in sensorium and any kind of a seizure or convulsion, generalized convulsions, which happens. So it's very difficult to differentiate with the eclamptic seizure convulsion with those because of a press or any other condition. So the patient has to be submitted for further imaging. In this case, the MRI is choice. Cortical venous thrombosis or CVT is another problem. So usually there are features of raised intracranial tension. There are convulsion, rapid alteration in sensorium, and usually neurophysician asks for MR venography to confirm a diagnosis. Once the diagnosis is confirmed, this patient required the anticonvulsant and anticoagulant plus a supportive treatment. And usually the pregnancy postpartum period, this is hypercoagulable state, and there's hypercoagulability. And on the top of that, this Indian practice of keeping the mother dehydrated, not giving a fluid and anything for next 2-3 days. So dehydration means hemoconcentration. Hemoconcentration means cortical venous thrombosis. At times we think about
So
the
we should
postpartum.
avoid. So we should avoid dehydration. We need to, in the postpartum period, the patient is still with us. So we
Yeah.
need to do that counseling part.
To hydrate you. This is when they taken with the family. So they dehydrate the mother. They dehydrate the mother and this problem. At times we suppose that in India, this is the greatest incidences of postpartum cortical venous thrombosis because of dehydration.
Okay. And there are so many patients of migraine. And they may come up in pregnancy. There is sometimes it abates and then perimenopausal again it comes up. So what do you suggest for migraine, which has a medical component and it also has a lifestyle component?
So can't do much. So initial period when the fetal formation is going on, when there is lots of neuronal migration is going on, we do not want to affect it with the medication. They are not much of a medication which are safe during early period up to for say from 8 weeks to 16 weeks when the real brain formation is going on. These drugs may affect this neuronal migration process and result into a fetal malformation or neuronal migration defects. In a later period, they may interfere with the closure of patent ductus arteriosus, PDA closure may be affected by this medication. So one has to very careful to choose a medication and give a relief. So paracetamol is safe. Maybe caffeine is allowed. It's a combination of caffeine and the paracetamol and other physical measure to get a rest, take a rest. Do not be a hypoglycemic. Avoid those factors which precipitate your migraine. This is a usual advice we give. And patient, obviously we cannot give any prophylactic medication for a migraine during a period of a pregnancy.
if you have a patient who already has a neurological disease, do hormonal fluctuations in pregnancy and menopause affect those neurological conditions?
Yes, both the hormone has a great role to play. So
Okay.
estrogen and progesterone.
Hmm.
I remember a story by remembering only estrogen. So,
Hmm.
like in a migraine, if there is a at the onset of a menses, there is a drop of an estrogen level that precipitated a severe migraine. This is called as a catamenial migraine. Okay.
Okay.
Estrogen in a stroke is a protective in a physiological age before menopause. But if you take a hormone replacement therapy, it's harmful. It increases the risk of a stroke. High doses of estrogen combined pill with certain salt of a progesterone and high doses of estrogen precipitate cortical venous thrombosis, increases up to 20-fold chances of having cortical venous thrombosis. So best part is remember one, either estrogen or a progesterone, and
Okay.
remember everything. So estrogen is, for that matter, is a pro-convulsion. It causes convulsion. Progesterone reduces the convulsion. That's the ways to consider all the hormonal play into various neurological disorders. But
It's
they do have an important role.
these days we have very low dose pills. So
Mhm.
have you seen a reduction in the incidence after these low dose pills have come up, or you still have that same pattern?
This is only a one factor. We usually ask our resident are in a habit of asking the history of oral contraceptive and its content. But this is not only this factor. There is another thing underlying the disorder, which is one is very relevant for a gynecologist. Like you ask in a recurrent loss of a pregnancy, you ask for certain antibodies. You ask for VDRL, lupus antibodies. There's a protein C, protein S, antithrombin 3 deficiency. There's charcot factor Leiden 5 deficiency. So there's lots of a workup which you have to done in this hematological workup you have to done in a patient of cortical venous thrombosis to identify what's contributing.
Okay. Okay. So that is a lot to take in for a regular gynecologist, but we
Mhm.
just need to remember basically. And there are always neurologists to consult if you have a problem.
Yes.
So,
So I think we have discussed all four common disorders. This is headache, which is migraine, convulsions or seizure disorder with anti-seizure medication. We have discussed the stroke and cortical venous. What remains is a myasthenia gravis. It sometimes causes a premature rupture of a membrane and leads into a fetal death. That you have to remember. Fortunately, there is no exacerbation of a myasthenia or multiple sclerosis during pregnancy, but they flare up just after a parturition. That's
okay.
that's what's
Okay.
like.
So that has to be remembered.
Uh-huh.
Okay. So
And
now,
consider neurologist as your brother.
yes,
That's most
you are
important.
our brothers for sure.
Yep.
So now we come to the last part of this neurology for gynecologists. Those who are managing postpartum neuropathies or nerve entrapments, you have that, here,
Yes.
carpal tunnel syndrome and others. What is your advice to gynecologists about them?
I think it's directly related to the weight gain. It's directly related to increase in the girth of a wrist. So this is a carpal tunnel syndrome. There's a because of pregnancy, increased weight. There's a pressure on a carpal tunnel behind the flexor reticulum. There's a compression of median nerve, and that causes a tingling numbness. And
Many patients complain that when they are sleeping, they have the hand like this
yeah,
and it
yeah.
goes to sleep.
So this splint and the disc support is the best thing which you can offer in during a pregnancy. So there's
Okay.
a
No
typical
medication.
wrist support and a wrist splint which is available. So apply those splint and explain them. It's going to go away with the loss of a weight. Maybe after 3 months or 6 months, it's going to disappear. At times, it happen on the outer side of the thigh, which you call as a meralgia paresthetica. That's a similar pressure over lateral femoral now, causing pregnancy-related now entrapment. So simply with the weight reduction, most of the time, 99% of the time, it goes away.
Okay. So like Modi ji, you also speak of weight reduction.
Yeah, sure. This is
Reduce
the
weight.
Yep.
So now we come to
Yeah.
the
Anyway,
part.
we are not going shoulder to shoulder with the Americans. So we don't want obese like them. Yep.
Yeah. So now we come to the part that makes you unique. That is the connection of the art, anatomy, and the brain. You have published papers connecting the Renaissance art of neurology, hand wasting in calumny of Appels,
Ah, this is very
genesis
interesting.
of extensor toe sign. How did these discoveries begin?
So when I was UK, during my free period, I used to visit this British Museum, and I used to look on those Greco-Roman paintings. That was my interest from where I developed during my Queen's Square day in London. I used to go to the gallery, saw a painting, looking at it. Then I suddenly realized that this painting are basically based on a live portrait. These are live portrait. There is a subject sitting on a chair. They draw that character and they increase the dimension by 1/4. Say your biceps by 1/4, deltoid by 1/4, and then you are typically looks like a Greco-Roman god. So your height is increased by 1/4, your body proportions are increased by 1/4, and you look like Greco-Roman. So these are the live subjects. So on one fine day, I was visiting this museum at Italy, at the Uffizi Museum, and I was looking at this painting of Botticelli that was around 15th century. Botticelli around 15th century.
Okay.
So that was a tempera. Tempera is the way of the painting with the egg colors, egg mixed colors, and there was a panel where the king was supposed to say a judgment against a lady, and he has already been informed that she is most corrupted lady in the society. So the torch bearer, the envy character, was snatching the girl by the hair, pulling the girl by the hair. His hand was very dark, vested. I thought in a Greco-Roman painting, what this character is doing, what this small, emaciated, dark colored person envy is doing. Then I thought about certain neurological condition, but then I said, how the Roman are going to know about those conditions like a motor neuron disease or anything. Then I remember I read one theory, which is a fall of a Roman. And they said the lead was one of the cause of a fall of a Romans. They use lot of lead in their sweetener, in their wine goblet, in the panels, cosmetic, everything they use a lead. And lead toxicity gradually leads into infertility, multi-organ failure, and these characters are typically dark, which is called as a plumbism, plumber color. So they are plumber colored, dark, and emaciated because of a pure motor neuropathy, and this pure motor neuropathy was very evident in me. So I published this article, and thankfully they accepted this.
And what about that extensor toe?
Say Babinski sign or extensor toe is a physiological below age of 2 years. And there is not a maturation of a myelination of those fibers. So typically the plantar response is not flexor, protective response like us. It goes extend, the grade 2 extend. So I was looking at this painting of Madonna with child at Prince Wells Museum, Mumbai. And the Madonna gently placed her hand on the soul of a Christ, this on the outer border, and typically the toes goes up. And then I observed this and said, Eureka, this is $1 billion painting, and I need to talk about it. I need to publish about it. It's still at Mumbai. And I have sent a copy of an article to chief curator of the Mumbai Museum at that time, Mr. Dilip Ranade. Whether he is still working there or not, I am not sure about him.
Okay. And you looked at different paintings of great Western artists, Botticelli or Raphael. What neurological signs catch your eyes?
Yes, so usually you look into anatomy. Basically, you start with the face. You look at any signs of a dysmorphism. It's like a reading a basic pediatric. It's like a basic pediatrician. When you look at a malformation, you look for all kind of dysmorphism, how the eyes are placed, how is the ear, how is the
That is
lips.
what fetal medicine people are doing today.
Yeah, yeah.
Yeah.
And then you look at the body proportion, you see any kind of emaciation is there. There's lots of muscle disease which are described in this painting. They are described. They have described even short and microcephaly in those paintings because there's really a microcephaly out there. So you look at the body carefully and then read
Correlate.
about that painting. What's the context is, and then you are definitely going to be there.
Do you think those painters were guided by anatomy? Did they have access to, dissection and those things so that they could,
Yes,
portray
yes,
things?
yes. So Renaissance artists, they have real knowledge of anatomy, like Michelangelo and other people. They usually dissect the body.
Because
They try,
Leonardo da Vinci was popular for that only. He had
yeah,
a
yeah.
lot of dissection done.
So anatomical correct depiction is there. Absolutely fine depiction of neuroanatomy and anatomy is there. Although the concept of a brain and soul was not clear at that era. They never know what inside the cavity of a skull. That was not very clear up to 15th to 16th century. Yeah,
Even Dan Brown has taken that Michelangelo painting as something in his book.
this is fantastic. So this
It's
is
a
a
whole
public.
novel. Many years back it had come up, and
Yes,
he had, just
yes,
compared it when he was actually trying to write things that are negative about Jesus.
yeah.
But
Mhm.
what I'm trying to say is that you, as a neurologist, you saw that painting.
Mhm.
Do you think it really correlates with the brain?
I
On
have
the roof
seen.
of the Sistine Chapel?
Yeah, so going to a Sistine Chapel, this is observation by Frank Marshberger in 1990s, and this famous article is published in a JAMA. Incidentally, that great gentleman was obstetrician and gynecologist. He was not a neurologist. So he
Okay.
observed this painting, which is called as a creation of Adams,
Hmm.
on fresco. This is some fresco on the Sistine Chapel. This Sistine Chapel is in a Vatican City, Rome. So
Hmm.
he saw this painting, creation of Adams, and the God is giving a life to the Adam. The whole this genesis of a life. So God is giving a life to Adam, and by the touching his finger. This is the painting like. This is a fresco like. The structure of a God is an elaborate, completely brain-like structure. It's such a beautiful observation. You can see the cerebrum, you can identify the brainstem, you can see the pituitary gland where it's situated, you can see the pituitary stalk, and you can see the sulcal spaces. It's such a beautiful observation done by obstetrician and gynecologist. He himself was a painter. He himself was a great painter, and he died few years back in the 90s. He died. So I read only at the same time this article when I was indulging into this painting. So it inspires me. It still inspires me to do something great. Yeah.
Thank you. Young doctors who are into medicine, whatever the branch, what would be your advice to them about observing art? Because most of the time these days, everybody is into one more specialty, one more subspecialty. Nobody is taking time out to observe art or anything else. So, what would be your advice to them that, just looking at all that gives you patience, perception, what else?
There are five things. Look at your patient here carefully. Look at your surroundings carefully. Look at nature carefully. Often visit jungles. It gives you immense peace, immense time to think about yourself. When you are not with an internet and you are not connected to net, you think a lot about yourself. And lastly, never fall into depression. Don't feel like a burnout from a profession. So remain in this world. Remain connected to the everything. Internet, WhatsApp is not everything. It's not going to take you anywhere. It may give you certain knowledge, but it's not that you should play 24 hours with these things. And lastly, museums are not for the children. It's not like your school teacher is taking to you to the museum and you look at the exhibits when you don't have any knowledge about this. Museums are forever. They are our treasure. So start visiting a museum. They are located at the most beautiful point in the city. Visit the museum. That opens up you towards art, Indian culture, Indian sculpture, and everything, Asha.
Thank you. Thank you. I remember going to a museum, but many years back.
Uh-huh.
When my
So,
father was there, he would insist on us all going, and reading about everything that is presented
yeah,
over there.
yeah. So whenever I visit a museum now, I see a line of children from school, accompanied by a school teacher, looking at the exhibit, making a noise inside, which is not the right age to learn about those things, I think.
Agreed. But maybe thoda sanskar pad jaye.
Yep,
Maybe.
sure.
So now we come to your wilderness and your jungle life. You have contributed to National Geographic. You're a wildlife photographer. We have all seen beautiful photos of your tigers and birds. So, how does that neurology connect with nature in your mind?
So everything, the background of this thing is good knowledge and to be a good photographer, right?
Yes.
And if you know a multiple language like a Sanskrit, and if you are able to read a Brahmi, which was a predecessor of a Sanskrit, then you may be able to read a many ancient signage there, isn't it? And it's going to be a fascinating. So right now I'm learning a Brahmi to read what's written in the down of a sculpture. So the photography is necessary, and basically we go to this jungle of a Taloba Andhari Tiger Reserve, which is in Maharashtra at near Chandrapur or Bandara, and it has got very high density of a tiger, and we work on it.
Long hours in the forest. Does that help you increase your focus?
Yes, certainly, and this has to do with the green color also. So when you look towards the infinity, you look into tremendous green color canopy. It gives you a inner pleasure, inner peace. Really, I mean it.
You have discovered an ancient Chaturbhuj Vishnu Murti.
No,
I
I'm
saw all that on Facebook and other places. So can you tell us more about it?
No, I am not an archaeologist. I have not done this excavation. Excavation has been performed in the 1970s by Krishnadat Bajpayee and S.N. Pandey. These two gentlemen came from a Sagar University, that time Hari Singh Gaur University, and they found out this image, and they said it's a 200 years before Christ. And to get any artifact of that age is very ancient. But then it was sadly locked into a small museum located at the Malhar. It's not in a public display. This is archaeological survey makeshift museum where they kept this sculpture. So on a second visit, I located this. It's lying there. On first visit, I failed to locate this sculpture where it is. There is one famous curator from Paris. She also came, but she could not locate this sculpture. Second time I was lucky enough. Then I was thinking about it, and you look into iconography of a sculpture. You try to confirm what's the age, depending on the relative position of Shank, Chakra, Gada, Padam. These are the four cardinal features of Vishnu. So, what the way the Shankha is placed, what the way the Chakra is placed. Like, for example, before 6th century, the Chakra was carried sideways near to your ear, this. And gradually after 6th century, it became like this, straight, looking towards you. So, there are the clues in a sculpture which tells the age of its existence. So, I discovered this, I think. No one likes to have such an ancient sculpture not in a public display, or not getting a honor which that sculpture deserve.
So how old is it?
It's 200 before Christ. So
And what are the
2002.
pointers that say that it is this old?
So the chakra is like this sideways. That says it's immediately behind sixth
Okay.
century. But the beauty came from a beautiful Brahmi Lipi sculpture on the shaft of a gada. So club shaft, upper shaft is having this Brahmi language. And they deciphered this Brahmi language. This was done by DC Sarkar way back. And then he read blah, 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 blah. It belongs to 2000. That's how it happens. And I believe it's the oldest and the most ancient sculpture, one of the most ancient sculpture of Vishnu across the world.
You know, you visit these temples and you visit forests and you visit different archaeological sites. How does that help you understand yourself, your life, your consciousness better?
No one thinks about their own life. It's a flow of a life, and you are following that flow of life. You never sit back and think about what you are doing, whether it's correct or whether it's wrong. But if you are pure in a practice, you have got an ethical approach. For doctors, for physicians, it opens up a many roads. If you are a pure physician with honest value, ethical practices, it opens up a door towards a much of a thought process. When you are serving your patients with the topmost honesty, that helps. That brings you a purity. That brings you a knowledge or thirst to learn more. Yeah.
No, but how does that actually, you're being an honest doctor, but you're visiting these sites, the forest, the temples, does that help you in your inner quest?
Yes, for inner peace, it's necessary, but I don't think it's necessary for my neurological practice. Neurological
Not for
practice is
practice. I'm not
perfect.
talking about practice. I'm
But for
talking
a
about you.
but for inner peace for myself, this is something which gives me an immense pleasure looking into those things. And believe me, the fund of knowledge you require to be a very good obstetrician gynecologist is much more than you combine my all subjects, whether it's archaeology or
You
wildlife
are
or
you are
art.
just being very humble that way. But the work that you are doing, the interest you are putting, and you bring it before the people so that people like me, we get inspired. You know, what has he seen? Let us go and have a look. So, you know, that is something really great. Now, another neurology question. That do you find a
Yes.
parallel between neural networks and the interconnectedness in nature and civilization? Today, even
So
the computer language is neural networks.
yes, yes. So I think it's a very interesting topic, and something belongs to right side of brain, and something belongs to your left side of your brain. So art and music is possibly a right side of the brain, a frontal part of your brain. They are centers the people are working on. They are connecting the art and science both together and localizing precisely by doing a functional pattern study. So once you are singing some song, or you are playing some old orchestra or some Beethoven symphony or something like, which part of brain you will get activated on a functional pattern. So people are learning about, they are working on it. Hopefully you will know which part of the brain is responsible for this, but basically right-sided brain, which works, right?
Okay. Now you have come a long way. What actually gives you fulfillment?
I have not defined this thing, the final goal or fulfillment or those kind of thing.
Okay, so let us not say fulfillment.
Yeah,
I have
it's a
already said archaeology makes you happy.
yes, yes. Going to
Photography
jungle,
makes you happy.
going to a jungle makes me happy. Looking at archaeology makes me happy. I already told you about my vivid dream that I am in a deep, dense forest and somewhere at looking at a old ruined temple complex looking at the artifacts there, something like a Rudyard Kipling or something like Indiana Jones without a horror or terror. So that's what I always dream of, and that's how draw my pleasure out of it.
So now, what is your advice to young specialists to keep their curiosity alive beyond their subject?
I think give less time to the electronics, give less time to the WhatsApp or public media where they are destroying their 80% of time. They are not playing outside, they are not going outside, they don't have a time for a nature. If they have a time, they have a vacation, they want to enjoy into a hi-fi city where those high kind of things are available. They don't want to go to the jungles or nature's place, or they don't want to visit the ancient site. It appear boring for them. So they have to have an interest on it. They have to open up. And it's a responsibility of parents also to teach children. Chalo, join me for this jungle trip.
Okay.
Photography is something which came behind. Learning Sanskrit or Brahmi may came along. So these are the things which are
Who was your
necessary.
teacher for Brahmi?
Brahmi, I am started learning. So the initial support is from older books, which says from Dravid to how this language developed, and what's the changes in the alphabet, what is change in the nature of those alphabet. So I'm going to be very happy if we together learn those things.
I would like
And
to
then
learn.
and then you go to the Raipur Museum, there's lots of signage or Shilalekh are lying there. You wrote those, try to read those Shilalekh, how much line you are able to read out of it once you learn those Brahmi language. So this is how. Yeah.
Okay. From
You are
a
now
neurologist sense, yes. What did you say?
you are not now knowing a lots of my secrets. So what to do a Brahmi and how to do this thing. Yeah.
Yes.
Continue.
So just the last question, that neurologists, for all of us when we were growing up, the brain was the center of our ego. It was also the center of our knowledge. It was like the divinity in us, centered in the brain. Now, being a neurologist, what do you think?
I think now more and more people, they believe in a scientific way of thinking. So during our days of a college, when the CT MRI was not available, the only thing which was available is those samples lying in an anatomy museum. We see a brain there, cuts of a brain there only. Or we read it through a book of anatomy, whether it's a Gray's anatomy or Cherussia anatomy, we look at the
My
brain
question
there
is
only.
different. I'm
Right?
asking you, how would you as a neurologist define the divine? For you, does the divine exist?
I do not involve a brain in this definition. I look it as a scientific structure, a part of a human body, right? And we believe on a CT and MRI.
So now,
Yeah. Thank you, Asha.
we are almost at the end of our program. I would like you to give a take-home point that we can take home as the end of this session.
I think don't ignore your interest in the hobbies. These are not what you call as a post-retirement शौक जो है आप रखते हो. These are for a lifetime. These are for your lives. Carry your job and the hobbies together, and they live a life to the fullest, and travel a less traveled road quite often. Right.
That is very beautiful. Travel a less traveled route.
Yeah.
And keep that beginner's curiosity alive in you all your life.
Yeah.
So, thank you so much, Dr. Sanjay. Thank you for an enlightening evening. And I hope we meet together and really do something on that Brahmi, which has my curiosity tickled.
And the photography. Okay. That's great
Let's
thought.
see.
Thanks for having me, and thanks to our society for calling
Thank you
me
so much.
for this.
Thank you so much.
You.
Thank you, Sunita ma'am, for allowing us to have an enlightening evening. Thank you so much.